Welcome back to Behind the Scrubs. I'm Dr. Rudolph Eberwein. I am a member of Friends of Medicine Foundation, and I'm here today with my friend and my colleague, Dr. Robert Poliszuk.
Nice.
And he's the doctor of physical therapy, and we're going to talk everything muscle, fat, recovery, training. First, I want to thank everybody for tuning in, and I want to thank everybody for their support. And I also want to thank our sponsor, New You Physicians Wellness, which is my own medical practice in Pinecrest, Florida. And I want to also say that all the information that you're going to hear in this episode is for educational purposes only. If you have any specific health concerns, please make sure to check with your physician. So Robert, so great to have you here on the podcast. Tell us a little bit about yourself.
Yeah, thanks for the great introduction. Yeah, so I graduated from the University of Miami in 2017.
Canes, baby.
Yeah, we're both Canes apparently. And when I graduated, I really wanted to focus on like performing my career and helping as many people as possible in the best way possible. So I started working at some clinics and it was like 4 patients an hour. And I was doing 2 evaluations an hour or 4 patients an hour. And that was horrible. So I was like, how can I help people without having to do that? So I opened up my own clinic and I slowly grew it. So now we have 2 locations, one in Miami Shores and one in Edgewater. And it's Physiologix is the name of my company. I don't know if I said that yet.
Great name, by the way.
Rocking the shirt. I know it's 5 syllables. It made it very easy for people to remember. Well, my name's not easy to remember either. So yeah, so the whole point of it was to help as many people as possible, but in a way that's effective. So like I could have helped 4 people an hour at this other place, but it made me realize what I really wanted to do, which is to provide effective care to people.
Yeah.
And I ended up in a bodybuilding gym in downtown. So this kind of relates to what you do. Because I know you work a lot with like...
Yeah, I do testosterone replacement therapy, body composition. Yes, completely. Our world, we have a lot of commonality here.
Yeah, there's a lot of crossover. And I think a lot of people that I work with, some of them might have even worked with you in the past, but a lot of them are interested in this kind of stuff.
Yeah.
You know, so it's definitely a different type of patient than most people get. Like most physical therapists are getting, you know, maybe older people or really young people or whatever. But a lot of my patients, they happen to be very fit, like younger, you know, I don't know, 30 years old. And what do you call that? You probably call that younger.
Yeah, man, I'm 54, man. But listen, it's so glad to have you here because it's such an important discussion, right? Because especially with social media, it's all about showing the 6-pack, making sure that you look good, especially we're in Miami, we go to the beach, right? This is, you go in middle America. Middle America doesn't look like Miami. We're so into our looks, which I'm all for it. I'm 54, I still have a 4-pack. I'm working on the other 2. But looking good is important to me. But what we're going to discuss today, it's what tools do you help your clients with, your patients with, to get to the best physique that they can, but even going beyond just the physical, making sure that we help our patients prevent injury, rehab the right way, even like the mental dysfunction that sometimes can happen with injury. And something we're going to talk a lot about is the use of steroids. I don't prescribe anabolic steroids myself. I prescribe testosterone replacement therapy when indicated. No matter what your age is, if you have low testosterone, I can help you. But I do a full blood evaluation. But what I tell all of my patients taking anabolic steroids is to be sure to go deeper. If you're going to use that, make sure you follow with the right professional, the right medical doctor or provider that will check all of your numbers, check your inflammatory biomarkers, because I like to say that health is wealth. We only have one life, one body. We need to take care of ourselves. So tell us about who your typical patient is, what their goals are, and how do you help them reach their goals?
Yeah, I mean, well, I have 2 aspects to my business. I also do treat people from their home. A lot of those are Medicare patients, and I have other therapists will treat them. So that's a whole concierge in-home thing. But that's in terms of who I'm treating in that gym, specifically the men. They'll be like my age, and a lot of the times they'll be either on steroids or testosterone. It's just common in that culture, right? A lot of bodybuilders, so they like to maximize their anabolism. So they'll be on it. And I've seen a lot of different levels. I've seen people who do it from what I believe looks healthy. I mean, that's just the eyeball test. I don't know if you would agree, but other people, they'll do it to levels where like they have noticeable like skin issues, like their skin looks funny. They'll complain about symptoms that I think could be caused by it, and they'll see things like tendon ruptures and stuff. And I'm treating them, and I'm like, this is probably a plurality of the issue is probably caused because they're running too much of something, and they're not they're not doing it very scientifically. They're not following up well. They're not doing blood tests and stuff like that too. But I do have a lot of patients because that gym is like everyone there kind of knows about the culture. Not everyone does it, but They are very careful what they do blood tests monthly.
Yeah, good.
They just take testosterone. They'll keep their levels high at a level that's super physiological, but it's under control. So the issues that I usually see them present with, like either not tendon ruptures always, but like tendinoses and
overuse. A lot of times it's overuse, heavy weights, many repetitions. And again, when you're 30, 33, 35, I used to lift heavier when I was younger. I used to really abuse my body. But as you get older, you learn how to become more gentle with yourself. You learn how to work out smarter, not just, like how many pounds can you rep, right? What's your best rep, right?
And I want to max.
Exactly. So what I want you to talk about is really, the one thing I want to talk about also, and it's on TikTok, the trend, right? Where all on TikTok, people are talking about taking trenbolone and anabolic steroids, and people are just going out there and taking it, not seeing a doctor, not doing blood tests. There's a lot of consequences that can happen to this. So if anybody's listening to this, and even if you take one thing out of this, if you're doing any of this, get your levels checked. Get your testosterone level, get your estrogen levels checked, get your hemoglobin checked, because there are some side effects that can happen that if you're not being monitored properly, we don't want you to suffer from this. Other things that can happen, gynecomastia, that's a big problem. Infertility, when you're taking steroids, I don't know if you know that, it decreases, there's a negative feedback loop to your brain where it stops your own testosterone production. So ask anybody who's taking testosterone or anabolic steroids, have them do a sperm check. It will likely be 0.
Jeez.
So if you think about fertility and you're taking those substances, make sure you do it with a trained professional, right? So what I want us to really focus now, Robert, let's talk about the importance of muscle. I call muscle the currency of longevity. Muscle doesn't just look good at the beach, doesn't just look good with a tight shirt. Muscle, and especially when you get to my age, mid-50s, your body cannot form muscle. We're no longer in anabolic conditions, we're in catabolic conditions. So our body burns muscle. So we have what is called sarcopenia. When you burn your muscle, it's difficult to build muscle. But muscle doesn't just look good. It actually has been shown to increase longevity, make sure that it helps with so many things in your life. Picking up your kids, picking up your grandkids, being able to be active. So muscle is so important for me, but I want us to talk about other aspects of training, like mobility training, stretching, and all these other things of training. Tell me your approach with your patients usually when you counsel them on how to work out and what their goals would be with the training.
Yeah, I mean, it really does depend because it depends on the patients, obviously their goals. So I do have female patients as well. I'll just talk about the men.
Yes, we will.
But even then, some men, their goal isn't necessarily to get super jacked, and I think I'm a good middle ground for them because I'm natural and I work out and they say like, oh, I want to look like you. I'm like, okay, that's awesome. Good. So I start thinking about the things that I do. But if it's someone that doesn't necessarily want to get very muscular, you got to find out what do they do, what are their goals. They want to build cardiovascular like endurance versus they want to build just huge muscles. I would never recommend, like I'm not in the position to recommend them going on steroids. I might like refer out to someone if they think they have low T. But, in general, I'm recommending things that start with good form. So like a lot of people, they want to just get right into weightlifting very heavy. They're not even doing really the compound exercises correctly, or sometimes they're overconfident. And they'll do like, well, I'm doing squats on deadlifts. Like I found this exercise on bodybuilding.com or some like
bodybuilding.
The old days, right? But nowadays it's not even that. It's like they have like a guy on YouTube they like that created a program on an app. So they pay like $30 a month and they're excited to follow it, but they didn't really go over the form. So the biggest thing that we got to knock down first is the form with the biggest exercises. That's why we go over hip hinges for deadlifting. We go over how to squat. We go over how bench pressing looks with dumbbells and with the barbell, push-ups, all those things so they can get the bases down. And then we start structuring their program correctly.
Amazing. And just like everything, start with the basics. I love that you said hip hinge. I'm a medical doctor. I never knew about hip hinging until I found a good physical therapist to really show me the proper form to do squats, to do deadlifts. Before, deadlifts used to give me back pain because I didn't do it with the right form. So the right form is such an important, everything we do in life, you need to master the basics first. So it's amazing that you do that with your patients. One saying that, everybody knows about this, it's a six-pack is made in the kitchen, not in the gym. Do you tend to talk to your patients about nutrition and the other basics of training?
Yeah, I mean, I have a patient right now. She's a girl, but this could go for men too. And she lost 15 pounds. And she's already little. She's like 115 now, but she was 130. She lost all this weight because one of her physicians told her to stop exercising completely because of her back pain. So she did, and then
bad advice.
I know. And then she followed that advice for 2 months. And I was like, you should have came to me earlier. So she lost all that weight. The same thing happened. I've had a guy with the same thing. So basically got down to that weight, and then just with some form fixes, able to do more things than ever. So just by altering some of those basic things, like she was able to get back. And then now it's like, okay, how do we lock in those gains? A lot of people don't eat enough. So they'll be doing PT, and we're doing great exercises that give a whole routine. I start building out like a program for them. And then all of a sudden they're like, well, I'm not gaining weight, and I still feel weak. So I'm like, okay, like, are you eating well? Like, what are you eating? And then they'll be like, well, today I had like a salad for breakfast and I haven't eaten anything since. So I'm like, you got to get your calories up. You got to eat your protein. Because even though it's PT and you're not trying to get huge, like you're still gaining muscles in certain areas. Now she lost more than 10% of her body weight. So you got to focus on getting protein, having a calorie surplus, as you know. And then that's going to be the starting point for those people. And other people, they may be overweight, and that could be causing them issues too. It could be even affecting their posture. If you're very overweight, sometimes people tend to sit and stand funny, and that could be making their back and their neck hurt. So then you got to think about, how lowering your weight will help. When we look at PT, like it's a continuum of things. It's not just doing these exercises. You got to sleep well, you got to eat well, you got to do the form correctly, and then from there you're maxing out all the opportunity to get better. So
master the basics. That's amazing, man. I think I'm gonna come and train with you. A lot of the things you saying, I really like it. Hi, I'm Dr. Rudolph Eberwein. I'm the founder and CEO of a New You Physicians Weight Loss Program, and we are delighted to be the sponsor for Men's Health Awareness Month series of episodes for Friends of Medicine Behind the Scrubs podcast. A New You is a functional medicine, health, wellness, and longevity clinic that I've had with my wife, Keisha, for the past 15 years. We focus a lot on helping patients lose weight, adopt better habits, hormone replacement, and overall wellness. I am an expert at using GLP-1 medications, testosterone replacement for both men and women, nutrition, behavior modification, and at the end of the day, I really try to help you be the best version of yourself. We also have a med spa associated with the clinic. We use cutting edge technology with the company called BTL that has amazing services like the M-Sculpt Neo to help decrease belly fat and increase core muscle. We have IPL lasers. We have the M-Face to help with non-surgical facelift. So I'm excited to be part of the group, and I will have an open house very soon to invite every member to come and check out my clinic. Thank you. You can reach my clinic at 305-670-2131. We are on social media at drweightlossmiami.com. Our clinic name is A New You Physicians Wellness Program. Our website is www.drweightlossmiami.com. Other things that I want to talk about, because I know you do rehab for a lot of your patients also to help them recover from injury. This is Men's Health Awareness Month. Talk to me about guys that you see that sustain an injury, especially guys, athletes that, work out a lot, and what the impact of an injury can have on the mental health of a guy that, used to be on top of his game.
Well, I had a patient today who's a guy, and he took 6 months off of exercise because his doctor, and his symptoms were bad. His symptoms were like he had shooting pain in his glute, but it didn't go all the way down to his foot or anything. It was just right here. And it was very bothersome for him, and obviously it hurt. He'd feel it all the time. He got some issues going towards his groin. So it was like, I think L5, S1, S2.
Ooh, and dropping science.
Yeah, people. I'm not even going to explain it. I think I'm smart. And then so basically it was radiating from those nerve roots into that area. So he got really scared, and he just stopped working out for 6 months. And he was like a whole different person. He was a little bit much less confident. And he was admitting it though. So if you heard me say this, you'd agree. So we got him started again with some exercises today, and he's just like, this is going to hurt. Like, I know it is. And he was able to do them. And then he's like, wait, I've gained some confidence back. So, but it totally changed his brain chemistry. And when you're like that long enough, when you're feeling like that for 6 months straight, that's like a chronic disease of your brain at that point. 3 months is all it takes for somebody to become like a chronic like with musculoskeletal injuries, at least. If it's 3 months of an issue, by then it's considered chronic, and it's a whole, then there's a mental component. So if it's 6 months and he has the injury for 6 months and he's thinking that way for 6 months, I'm no psychologist, but I feel like that's got to be like really not great for your confidence. So he's over here just thinking that he's weak, he's getting fatter, he's depressed about it. So sometimes as PTs from the back end, we can make them feel good. And then they gain confidence back. So you see them get happier throughout the...
Amazing. Movement is so important. Exercise. I've exercised my whole life since I was 14 years old. And I can proudly say until now, I can do squats. I can, I do about 100 push-ups a day. That's something I've done since I was young. Just in between patients, you'll see in my office, I have all my equipment. I'll do push-ups, I stretch, I do abs, I do planks. Because you know what? Exercise is important. You said something really important for mental health. Exercise to me, an antidepressant. It's the best free antidepressant that you can have, right? Muscle, the currency of longevity. Maintain your muscle. You will live a better life. So everything we're talking about here, it's not just about the looking good. I'm all for looking good, don't get me wrong. But we need to go deeper. We need to go deeper and look at inflammation, functionality, mobility training. And, anybody listening, if you need somebody, I'm going first, but he seems to be the man to call.
Thank you.
Yeah, man. Another thing I want to talk about, although this is mostly Men's Awareness Month, you talked about a female patient that you had. Women tend to be afraid to lift weights because they think they're going to bulk up, they're going to look too big. I'm like, absolutely not. Women, they need to lift weights because, as you go through menopause, you lose your hormones. Same thing that happens, sarcopenia, and then even osteoporosis. What's the best treatment for osteoporosis for women? It's lifting weights, right? Yeah. So what you're doing, you're not just affecting people on the outside, you're changing people's lives, my friend.
Yeah, thank you. Yeah, no, she definitely needed it. So hopefully they heed the advice and drink their milk and load up their spine a little bit so they can get stronger bones.
Yes, sir. Yes, sir. So any parting thoughts about men's health? What would you, for anybody, any men listening, November is Men's Health Awareness Month. What would you say to a guy listening to this right now?
I would say if you're not working out in any way at all, that it's good to start something. Start somewhere. And you don't always need to work with a PT or a trainer, because I won't plug myself like that. But starting off simple and just maybe even 30 minutes a day. Or if it takes you to commit by maybe getting a gym membership that's affordable, just so you know that it's taken away and you should be working out. Don't wait until January 1st, because we're at that time of year where everyone's going to start being like, well, Thanksgiving is coming up. This is the best time to work out.
Right now.
Just start now with something and then start small. Maybe even if it's a class. And then slowly build up. And then I think when you start getting a couple rounds underneath you, you're going to realize how helpful it can truly be. And when you're aging, because I think this podcast is kind of tailored towards people maybe like 35.
Watch yourself, man. Yes, I'm old, but don't say it.
30, no. Aging like you.
Yes, sir.
I feel like 35 plus or something, like, you tend to see decreases in testosterone. So like, I think I'm assuming by exercising and eating well and having good mental health and good sleeping habits, that your test levels will be at a much higher level than if you don't.
No questions.
So start getting those things down, and then I think that you're going to notice that your whole life is better. You feel more confident physically, the way you look, and just your overall like blood serum levels of everything will be great. I mean, I'm lucky enough where not lucky, I guess I chose to do this. But when I started playing football, I continued the fitness lifestyle my whole life. And now I'm addicted to it.
Yes.
So it's just part of my life.
Best addiction.
I was going to say, I could be addicted to other things.
Yes, that's the best addiction. One thing I want to talk about really quick, it's what you said was beautiful, right? Start now. There's never a better time to start than now. And start wherever you are. 10 minutes, 20 minutes, 30 minutes. But the one thing I hear a lot from my patients, men or women, they'll tell me, yes, I walk every day. I walk 4 miles, 6 miles. I walk for 2 hours. I'm like, look, I'm glad you started something. Walking is really important, but you need to lift things. You need to do resistance training. You can't just do cardio. Again, the importance of muscle, I think we've stressed that importance enough. So tell me about a patient that you would see and be like, I exercise, I walk only. What would you tell them?
Well, I get that sometimes. Right? I get that from people. I would say that's a great start. That's like what the American Heart Association recommends, I think, 30 minutes of walking a day. So like there's somewhere that's actually good. I would be positive. I would trick them.
Yes.
I would be positive. I'd say that's great.
That's great.
Because you're following certain aspects to have a healthy heart.
Yeah.
So now let's get your whole body healthy too. and let's prevent things in the future, like being too weak to walk.
Yes.
Or having the issue with these like osteoporosis. Like, let's start with something easy. Like, you're in a gym now. I treat out of a gym. I'm like, you can come in after the appointment and stay for an extra few minutes while I'm here, and let's try some basic movements. And I think you'll see that it almost gives you like a euphoric rush, you know? So I tell them that people don't really realize that part either.
Yes.
It's like, it feels like a drug.
They call it the running high. I get the lifting high.
Yeah. It feels crazy.
Hey,
right?
We just came up with a term here, the lifting high. When I lift weights, my muscle, my body feels great. I'm addicted to it. I don't see myself not lifting weights. I'm not a big cardio guy. I do HIIT training, but I love to lift weights, and my muscles respond very well to it. So you heard it from the expert. Robert, this was amazing. Any parting thoughts is really, if you're listening to this, start moving, start lifting, start resistance training, get your numbers checked. And you know what? Just be out there and do something about it.
Yeah, for sure. I love it. Yeah.
Very good. All right. So I hope you enjoyed this episode. So you want to say it again, like plug in your clinic and what you do?
Yeah, no, Dr. Rob Poliszuk with Physiologix Physical Therapy. We will treat you from our locations. We have one in Miami Shores. We have one in Edgewater. And also we do in-home PT for anyone that has Medicare or any other insurances too. So you do one-on-one with me or one of my awesome PTs that treat people from your home. And if you have Medicare, it's free. So you can't say no. And that's great for them because a lot of them have slip and fall issues because they're not strong enough and they never tried exercise. This generation's a little bit better at it, our generation. So follow me.
Thank you.
Physiologixpt.com or Dr. Rob Poliszuk on Instagram, if you guess how to spell that one.
Very good.
All right, thank you.
This was a great episode. I hope everybody got something out of this. And if you enjoyed it, please like, share, and follow. And we will have all of the links under this. And see you next time.